just because there's quite a big number of you and it was going to take up our time. But I'm Julie Hoodless. I nearly said designated clinical officer. I'm in a new role-ish still. Head of SEND for NHS Cheshire and Merseyside ICB. Prior to that, I was a designated clinical officer, and I was the DCO for Warrington at the time of the inspection. And my colleague?
Hi everyone, I'm Paula Worthington. I'm Director of Education and Community Services, Deputy DCS. My service portfolio covers schools, SEND, early help, early years, and a variety of other connected services.
And this is hopefully the workshop that you've intended to log on to see and to take part in. So we're sharing our insights today from Warrington. We were one of the first 3 areas in the country to undergo inspection under the new framework and handbook in January, February this year. And to share our experiences with you. What we will say right from the outset, and we'll comment on this a little bit towards the end, is that the outcome of our inspection was the middle outcome, inconsistent experiences. We're well aware that there are other areas that have had typically positive experiences, but we've been asked really to give insight into the process. So hopefully that will be of some value to you as we go along. We've a series of slides. We would invite you to add your questions as we go along, put your hands up as you go along to try and make this as interactive as possible. And with the timing from the last one, there's normally a few minutes left at the end to ask any other questions as well. So if that's all right, we shall carry on. Thanks, Joe. And just to set the scene, first of all, in terms of, we're talking about the actual experience of the inspection. So we're going to take as read several things on this workshop. We're assuming that you have a knowledge of the SEND inspection framework and handbook already. We do have briefings that we've shared locally in our area. If you're not familiar with that and you're brand new to SEND, and that would be helpful to share with you, no problem. That you've got an understanding of the 11 evaluation criteria that you will be measured against, inspected against, and that you're familiar with the components of this 3-week inspection and the possible 3 inspection outcomes. So I won't say any more about any of that so that we can really talk about the process. And then we're going to start by setting the scene in terms of what you can expect from the SEND inspection team. So I'll go over to Paula for this bit.
Okay, thanks, Julie. So as you can see, it's a mixed team. It would be fair to say that the inspection team were a new team in terms of working together. They were still finding their way and navigating through the SEND inspection framework. One of the things that we observed is that normally you would expect in an ILAX, for example, or a JTI, that you get to meet the inspectors and see the whites of their eyes and get a sense of who they are as people. The first 2 weeks of the inspection happened remotely, so we only ever met them on screen, and it wasn't until week 3 that we got to meet the inspectors in people, and that did feel very different to us and for staff. So a large inspection team and added to during the week, but yeah, a very different feeling experience, I think, in terms of the remoteness of the inspection team.
Absolutely. And if we move on to the next slide, what we're going to do is really talk through our key learning across the 3 weeks of the inspection and to try and bring that to life to you, really. What we'd say is that you get the call early on day 1. The call came in about 9:30, and that seems to be about typical. So that you get that call and immediately you will have in place who needs to be contacted, who needs to be aware that SEND inspections now started. And it does start on that day 1 of week 1. What we'd say from our experience is that for all those who are involved, whether you think you're really well prepared for inspection, we weren't expecting to be the first area. Cheshire and Merseyside, Warrington is one of 9 places. And actually, going off the chronology of the previous inspections, we weren't expecting Warrington to be the first, but we had already put in place some SEND inspection preparation. No matter how prepared you are, there will be some level of anxiety when that call comes through. And I think what we'd say from our learning is right from the very beginning, you need to prioritise the health and well-being of everybody who's going to be involved in this inspection going forward, because we'll all deal with it in slightly different ways. So there were briefings that were sent out to make it really clear what the expectations were and to provide some words of support through the process to everybody who was involved. For the core team who were there working together, it was, you know, making sure there were additional catch-ups. It was checking in with people, because I'd say it's a 3-week process. It's rigorous, it's exhausting, and there'll be times when we all kind of went up and down in terms of our energy, because you can't maintain that adrenaline rush of we're on inspection for 3 weeks as you might have been able to previously on a 1-week inspection. So it's checking in with people. We had straight away a kitty for coffee runs. You know, there were cake moments when we felt like we needed a cake moment, or whatever it is. Make sure that you are checking in with people, because what you want is, from the end of this, whatever your outcome, that nobody is experiencing harm as a result of it, and everybody is taking the learning from the process so that we can move forward positively as a local area partnership. So that's really key. On that initial call, you are told that there'll be a meeting with lead inspectors at 1 o'clock on day 1. It's virtual, as Paula has said, and there are key people at that meeting, Paula, aren't there?
Yeah, we kept a smallish group of people deliberately, and we did throughout the kit meeting. So really think about who you want there. So there'd be myself, there'd be Julie as our DCO. We had one of the senior managers from the kind of ICB link, and we had the LANO. And the LANO was the local authority nominated officer, is really key to be there. And just picking up Julie's point about self-care, I would say that the person that most feels the 3 weeks is the LANO. So you really need to keep an eye on that person. They're the person that the inspectors will go to for everything and anything, throughout the day, early in the day and late until the evening. They're the person that really holds the baton for a lot of the information, a lot of the population of spreadsheets. Social care weren't initially. We did factor in our head of service for children in need. And one of the comments from the inspectors is they felt that social care possibly didn't recognise the role that they needed to take within the SEND inspection. And that's probably true, and some learning for our colleagues within social care. So as I say, we did pull the head of service for children in need in, because he line managed the children with disabilities team. So it's an interesting one, I think, for the inspectors to test that role of social care and social care within SEND. And we did a lot of conversations around the DCSO role, and that hopefully what that does is cement social care into the process now going forward.
And yes, the local area does have a disco, and she was fully involved in everything throughout this inspection process, and probably would have gained a lot of learning from it. I think she would, yes. She would agree as well. Yeah. And one other thing I didn't say as well is, you know, if you have an email etiquette at where you're working, that you don't email after 7 o'clock or whatever, we relaxed that over the 3 weeks, because we felt that actually, well, our LANO in particular liked to work from about 4 in the morning. And for her to be able to send emails as she'd done them to gather the information she needed, we all knew we'd log on at some more reasonable time and see 10 emails from her. And whereas that wouldn't have been appropriate normally, we kind of agreed that that was okay for inspection, and that nobody was expected to reply at 4:05 in the morning. That's when she shared them. So it's just understanding what works best for everybody, really. On that Thursday as well, inspectors at that meeting are checking that you're familiar with the framework and the handbook, and the handbook is something that they will refer to throughout the whole process. So you need to be really, really familiar with it. It's the Bible in terms of, you know, what's going to guide you in terms of the process, and they do stick to it rigorously, I'd say. And also the Annex A, you know, Annex A, you're prepared for it. They will require all those documents by 11 o'clock on day 2, and the deadlines are deadlines. You know, I wouldn't really want to be breaching deadlines as much, you know, as is possible. So being prepared for that, things like the health commissioning template, the social care template, you can have pre-populated and ready to go, and just be revising those as you need. In terms of the dynamic support register, there were some queries about whether this should be redacted or unredacted. You need to make it clear. You'll get the challenge from health colleagues in particular, you know, about information sharing agreements and the like, but actually inspection, you know, top trumps any of that in terms of they can look at what they want. They will explain their, you know, the guidance they're working under, that they can access that information, and they require unredacted information. They need that person level data to be able to select the tracked cases and that kind of thing. So it's been ready to have those ready to go. You could have those pre-populated. And in terms of surveys, the surveys went out early. They are wanting a high return of the surveys. In Warrington, we returned 950 responses across CYP, parents, carers, practitioners, and they were happy with that as a general measure. That we did daily nudges to, say, for example, health professionals to make sure they'd completed their surveys as well. And then they're confirming the tracked cases on the information that you share with them. There are 6, and they will let you know about those. It was around 3:30 on day 2, because then the focus of week 1 is around the chronologies and the information that you need to upload by 5 o'clock on Friday for them. Apologies that there's some work going on outside my window. I hope you can't hear. Perfect timing. Let me know if I need to mute in between times if it's distracting. So in terms of that Thursday, Paula, was really crucial, wasn't it, around the multi-agency audits?
Yeah, it was quite key for us. We challenged one of our tracked cases that they'd selected. The child was subject to child protection proceedings. We had to do quite a bit of work with Ofsted to say to them it would really not be appropriate for them to be contacting that family and asking them about SEND, given where the family were in court proceedings. The other bit that we did was spend a day on a multi-agency audit. We developed a template which we can share if that's helpful to anyone. I chaired the audit day. We brought all of the partners together who were involved in all of the cases. And actually what it did was give us a really good insight into areas that we could immediately see where there might be some areas for question, some areas for challenge, but also the real strengths. And so just worked with practitioners to develop that narrative about really highlighting the strengths, being clear where there might be some areas for development, but mitigations for that. So, for example, reaching into our schools, we saw that some IEPs for those children weren't as strong as we want. So went back to the schools and talked to them and asked them to really talk as part of their inspection process about how they'd done that. It was really powerful for staff to do that, and it just meant that they really knew those cases in incredible depth. You're on mute, Julie.
I'm conscious of the tractor or whatever it is next door.
Can't hear it.
Oh, that's good. So yeah, and again, for the tracked cases, just to give you some kind of reference, for Warrington, there was 1 4-year-old, 1 8-year-old, 1 12-year-old, a 15-year-old, a 17-year-old and a 21-year-old. And the focus for us was very much around mental health and around transition. So it wasn't a young person from the DSR, but it was somebody who'd been on the DSR previously and had been a tier 4 admission and then back in community. So it's bearing that in mind. It was 4 AHCPs, 2 SEN support as per the framework, as per the handbook. And yeah, so, and the expected as well, when we started to pull in the professionals who were completing those chronologies, and you need to prepare your health providers in particular. This will be a short turnaround, so you'll be told the names on the Tuesday, and we set a deadline of, I think it was the Thursday at 4 o'clock, ready for the uploading on the Friday, because we'll come to that. And you know, that was like, oh, we might not be able to do that, and it was like, no, you're going to have to do that, and making sure that they're aware that that will be the ask. The ask of health providers in this inspection is quite high compared to others. I mean, in the process, we had community paediatricians, GPs, therapists, nurses, mental health practitioners, a whole range of people who were actively involved in this inspection. So it's preparing them. And then when it came to uploading, Paula, that presented quite a challenge at times, didn't it?
Yeah, the expectations are quite significant. They'll request huge amounts of information from you. I would suggest a conversation with your IT. What we found is some real challenges around firewalls. The Ofsted portal is quite difficult to use. We have our own firewalls and our health colleagues have firewalls. So there's just something to negotiate that. I think the other thing to prepare yourselves and your Lano for is that there are great swathes of information requested for on looking at the information, I would say that they read about 38% of the information. That's quite difficult for Yolano, who's inputting all of that information. So just manage that. We took that as a sign that actually we were answering their questions and they didn't know to go and read further information. But you will get asked for a huge glut of information that won't all be read.
Brilliant. And if we could move on to the next slide, Jo. So week 2, so you get at the end of that previous slide, it was very much that they will talk to you about their emerging key lines of inquiry from the end of week 1. Week 2 is very much around those tracked cases, being the meetings for children, young people and their parents, and the professional tracking meetings as well. And they were all virtual. One thing that we kind of reflected on is that in terms of contact being made to those families and those children, young people as being part of the inspection, the expectation was that the local authority would make that contact. Upon reflection, they might not be the best people to actually make contact. So in one case, in particular, a parent who was having quite a lot of interventions from children's social care immediately went into panic and said, have I missed an appointment? Have I done something wrong? You know, am I in trouble? Quite understandably. And we kind of reflected that the last thing we want those who they track to feel that they can be fully involved in this and giving their view, giving their experience. So it might be more appropriate for SENDIAS or Parent Carer Forum to actually make that kind of contact with the families, because the last thing you want is to trigger them if their experience hasn't been positive on their journey. So it's just something to kind of bear in mind. And in terms of the tracked meetings with professionals, they were all virtual. They need to be, from a health point of view, clinicians who were involved, so not managers, clinicians who've actually seen and know the children and young people, who can talk about their involvement in it, who can share their records as evidence of that. One thing to bear in mind, at each of the tracking meetings, the inspector started off by saying, do you all know each other who are in this virtual room? Now, we've got thousands of children with special educational needs and disabilities in Warrington, and 2 of those tracked cases were those at SEN support. So perhaps a little unrealistic, and we have a turnover of staff, perhaps a little unrealistic to expect everybody to know each other around every single case. That did prompt a key line of inquiry around, could there be silo working in Warrington, which we were able to then provide lots of additional evidence to suggest that wasn't the case, and that key line of inquiry was closed. As you know, that's the way kind of inspection kind of works. For me, week 2 was very much around populating the timetable for the focus sampling group meetings in week 3. From a health point of view, the CQC inspector had a particular ask. She, on top of anything that was provided within Annex A, she asked for staff lists of the particular focus groups, and she selected the list of attendees that she wanted. In the main, we were able to provide that. There was some where we questioned. So somebody who was at band 5, who was 3 weeks into post, and and she said, no, I want that person in, not an experienced band 5. One was at university. We were able to do like for like changes, but it was very bespoke on that. And again, no managers in the room, only those who she's going to be able to access records where they've inputted into, so they can talk about their involvement in that child or young person's kind of experience, really. The other thing as well that I think was specific to Warrington, and what I've heard is different elsewhere, but just be prepared, is that our CQC inspector wanted all the meetings to be at the local authority base rather than go out to meet them in their settings, which was fine, but it did create an IT job. So there had to be separate IT availability to make sure that everybody had 4G enabled laptops, because those focus sampling group meetings that we'll come on to in week 3, they're not focus groups as they were in the previous inspection, where you could talk about your best practice and have perhaps some parents there and bring their experiences. It's about accessing clinical records. So she wanted them to have done a pre-visit to make sure they'd be able to access their systems. That included GPs accessing EMIS, community paediatricians, therapists. So quite a lot of an ask in terms of the health providers being ready to be able to access those records for week 3 in those focus sampling groups. And then in terms of the setting visits, Paula, it felt different this time, didn't it, than previous inspection?
It did. So we had a couple of special schools, some schools with resource provision and a nursery selected. All did the preparation that you would expect them to do for Ofsted arriving. What was very different, and I hope has changed because we gave them a lot of feedback, is that they turned up to the setting and went no further than the head teacher's office, and literally spoke to the head teacher and then left. So staff had got ready for tours around the school to introduce them to children, and the inspectors didn't want to do that. So that's something just to maybe check whether that's their intention to do that, because we've been left with some settings who feel very disenfranchised by the process.
Yeah, absolutely. And like I say, they didn't see any health settings at all. All health colleagues were actually brought to the local authority headquarters, which I reflect is it's a bit of a shame that you've missed those opportunities to actually catch people in waiting rooms, perhaps see the end of a therapy session, as would have happened in the previous inspection. But that's very much the way this inspection works. And then in week 2, I think the key thing as well to be aware of is that there was a local area context remote meeting where you had a half an hour slot for the local area partnership, the key leads, to present their presentation that again could be prepared and rehearsed, we would recommend to you, delivered to quite a wide audience, the whole inspection team. And quite a bizarre one in terms of, you're told beforehand there will be no questions from inspectors, but it still feels quite like the presentation's delivered and they say at the end of it, thank you very much, and then they all log off. So there's a bit of a tumbleweed moment in terms of, was that okay? What do we think? Which does leave you a little bit wondering. Expect it, prepare everybody, that's what will happen, and then it won't perhaps feel as blunt of a thanks and bye as we probably experienced.
No, just to add to that, that the next week was the self-assessment presentation. Yes. And certainly for colleagues in local authorities, the SEF that we submit as part of our peer review process and annual conversation with Ofsted, the regional process through ADCS systems, we had sent them our SEF and said that we weren't doing a presentation, that was for them to ask us questions on our SEF, and they were fine with that. They liked the SEF outline. They felt that they could develop questions from that, and they then asked us questions on our SEF. So because we'd done a presentation, the 30 minutes for the local area context, we didn't then do a presentation for the SEF session, and they were absolutely fine with that. It might be something that you want to check with them, but it just saves you maybe doing some extra work and some extra presentations.
Brilliant. Can we move on to the next slide, Jo? That'd be good. Just 2 slides left. So there at the beginning of week 3, day 1, is that SEND evaluation meeting. And again, you've got a wide audience at that meeting, including senior leads. The inspectors, the whole inspection team will come in and they'll each have questions prepared for specific people around that table. And again, it's just being clear who's going to answer what. So from a health point of view, as a DCO, I was answering questions about compliance with EHC needs assessment, our health advices, but any commissioning kind of questions, I would be alerting my commissioning colleague. I was expecting him. So there was a lot of, that's one for you, Steve, kind of across the table, so that you've got the right person answering the question, who's got the information, and then the kind of backup. So that was really kind of key, I think, that, and it's a long meeting and it's quite rigorous. So again, you need to know yourself inside out so that you know exactly the kinds of questions that you're going to be asked about. The rest of the week is all about the focus sampling groups. Again, like I say, no service leads to be in there, no team leaders. It's really about accessing children and young people's records across a variety of systems. And again, that posed a bit of a challenge, Paula, didn't it, for some groups?
Yeah, there was I suppose mixed messages about who could be in the group. So we'd shared who was there, their job titles. Some people were asked to leave and not told why. And when we asked the inspectors, they'd said that they decided they didn't want senior practitioners there, for example, or team leaders, but they didn't tell staff that. And staff came out thinking that they'd made some horrendous mistake and were messing up the inspection. So again, we fed back to Ofsted. If you explain to people why you're asking them to leave, then that's fine. But actually you could tell us that beforehand so that we don't put people into the room. There was also a challenge around asking staff to bring in their laptops to show live contact or experience with children and families. We have Mosaic within social care. Within education, we have IYSS, we have Capita, we have Sims. People were having to move between different systems, which takes a bit of time. And Ofsted got a bit frustrated about that. And I think our feedback to them was they were being naive in not recognising within large organisations across partnerships that actually there'll be a range of management systems that staff are having to access, and they don't capture information all in the same way. So again, that was just something we fed back to them, that they needed to have a healthy realism about the way that we have to work within our organisations.
Absolutely. And for us, it was very much around, because we weren't allowed in any of those meetings. So as a DCO, I felt like I was listening at doors almost, that you've got some kind of way of communicating between all of those who are involved in the tracked cases and in those focus sampling groups, whether it's a template, whether it's via email, because we were meeting with inspectors morning and evening sometimes around the key lines of inquiry that we're developing. So it's really understanding what their hypotheses are and how they are either closing them down or they're continuing, so that we could bring in the right kind of information to assure them where it's necessary. So having that comms in place is really important internally as well. I think the other thing as well is just to be aware of a couple of concepts, just so that you're ahead more than we were really, is that one of the big frequent phrases that popped up all the way through the process was about professional curiosity. What they're looking for in a really healthy partnership is that we've got partners who have a healthy professional curiosity about everybody else as a partner, so that the educational psychologist is curious about what the speech and language therapist is saying, and the SEND casework manager is curious about what the teacher from the school is saying. And actually, I'm a great believer in reflecting on language, that neuro-linguistic processing kind of thing. So, getting in there early in terms of presenting yourself as being partnerships of professionally curious people, I think I would advise. Similarly, there was a definite difference in terms of emerging kind of outcomes and impact. Whereas in the past inspection, if you talked about anything you were going to do, you would be abruptly cut short and be told that's Jan tomorrow. You've had 3-4 years of the SEND reforms, they should be embedded, and they would discount anything that wasn't evidenced. There is definitely more of an understanding that they will appreciate the green shoots of some projects that might be an initial phase of rollout, but you've not got the outcomes and evidence yet. You can see in the inspection letters they will say it's been rolled out and we've no impact yet, but they would give some attention, they would pay some attention to those kind of projects. So again, if I were you, I'd be phrasing, we've got a project here that's just been started to roll out, but we're seeing the green shoots of that, and that would get their attention to kind of pay some attention to it, rather than, it can't still be a plan on paper or in somebody's head, but you've got something that is starting to show possibilities of positive experiences from children and young people. From a DCO perspective, very different this time. I had a meeting. In the previous inspection, it was always Monday at 3:30. You'd had the real rigorous kind of interview in terms of, did you have a grip on the health oversight and the local area? This time it was much more like a mop-up session on the day before the end of the process, and really didn't have that much substance to it. It was a little underwhelming, if I'm honest. So being prepared for that, having your health colleagues, being prepared for that as well. And then we did have as well, Paula, didn't we, a quality assurance session that hadn't been timetabled, and we think now was possibly quite crucial.
Yeah, so it's Julie and I's bone of contention really that we gnash our teeth about. So we were asked to meet with the QA inspectors, and we were told that was to QA the Ofsted inspectors and their process. As part of a conversation, they kind of casually said to us, and where do you think you are in terms of the judgments? Our initial response was, well, you're probably going to tell us that. And so they pushed us and said, where would you put yourselves? And being the people that we are, we're quite transparent. We said that we would probably say that we were in the middle, and that was probably where they were thinking. I think the feedback had led us to believe that we could have got the positive experiences. And so we wondered whether we actually we created our own downfall in some respects. So I think just be aware of that question. We briefed some other local authorities, and I know that some of them have been asked and said that they're not answering the question, that's the judgment for Ofsted to make. So it's just to give you the heads up that we don't know whether that's right or wrong, but we probably wish that we hadn't said that we were probably in the middle, because we think we maybe led them to that.
Yeah, absolutely. And again, final feedback on the last day, there is a pre-sharing of what the outcome will be before you go into the big meeting. No surprises, you're hearing the language that's going to be in that last letter really throughout the whole process. So there's no surprises. And you're really looking to hear for whether you've got areas for improvement or significant weaknesses, or typically positive versus inconsistent in terms of what that outcome might look like. But again, I think it's been there as the senior leads within a local area about how people receive that information, Paula, and you know, being there to explain what that means and where that sits.
Yeah, so you've spent 3 weeks keeping morale buoyant amongst your staff group, really reassuring people, taking them to the right key messages. You then bring together the great and good. So, you know, the chief exec from the council, I had my director of children's social care there. We had our lead member, leader of the council, senior people from the ICB. Ofsted had a really quite buoyant conversation with us beforehand, told us the judgment, but a good conversation. They then walked into the feedback session, and this is my language, it was very, very deficit based. It was very factual and cold, and that was quite difficult for staff to experience who had spent 3 weeks working really hard, but also very senior people you have in your organisations who only then get to hear a very narrow representation of the areas of concern. So I think it's just warming people up to that. I've had to do quite a bit of work afterwards with the chief exec just to make sure he heard the rest of the messages that we'd been hearing for the rest of the 3 weeks, and the messages that weren't in the report. And again, we gave that feedback to Ofsted, and that was reflected in the 2 other areas that were being inspected at the same time as us, that the feedback was very deficit based. So just to warn yourselves for that as well, because it's quite hard to hear.
And if we can go to our last slide. So this just summarises our kind of reflections. You know, we've shared our learning widely, hopefully to the benefit of others going through the process. What we notice, as you will have, is that inspection letters typically evidence the same kinds of challenges, the long waits we've talked about earlier today, around therapies, especially in CANS. But what we see sometimes is the similar content in a letter and a different outcome. And that happened quite quickly after we'd had our inspection. We could see very similar content and then a different outcome. And what we really can see is that the same situations can be mitigated through positive communication, although we're not going to use that phrase waiting well anymore, are we? That you know, if there's detailed recovery plans and trajectories and the involvement of the PCF in co-production, our parent care reforms were incredibly positive throughout the whole process, and we're almost as disappointed, I suppose, with the outcome, probably more so, I think, than we were really. But there we go. And then for me, you know, in large ICBs, it's very much again how you share that with partners. And for me, the learning, say, from the Oldham letter is very much that whilst we're putting all our energies into an ICB send data dashboard, don't lose sight of the grip of health data at place, because that could leave you wanting. And we were able to produce all the data that they needed quite quickly, and they interrogated some really specific things like wheelchair weights and things right back from the previous inspection letter that had been resolved very quickly after that one, and they'd gone back to it. And I think one just final thing in terms of, you might think you're doing okay with your 20-week compliance in terms of national average, but Paula, it was still an area for improvement for us, wasn't it?
Yeah, we were higher than the national average and presented that to the Ofsted inspector. We weren't where we wanted to be, but we were higher than the national average. And the reflection back from the Ofsted inspector we were meeting with was he didn't think that the national average figures were good enough. And so that wasn't a benchmark that he was prepared to use, which is quite difficult when you're on a trajectory of improvement and you're at least saying to staff, you know, we're bucking the trend in terms of national average, but then to be told that that's not good enough. It is that challenge around that kind of system join up really, and some consistency and some of that standardization that was being referenced in the initial session this morning.
So they're all our slides. We've put at the end of the presentation our email addresses, and Paula's put them in the chat as well. You're more than welcome to contact us around anything that we've covered. I mean, Joe, if you pull the slides down, thank you. I've not spotted any other questions in the chat, but we've got just a few minutes left. If anybody wanted to ask anything specific.
We'll get the template over. It just won't let me. It won't let me post it for some reason. So I'll get that across for people.
Camilla?
Thank you so much. I was typing away and making loads of notes because I think there was some real nuggets of great information in there. So really thank you for sharing those. You did mention that your step went down. You felt went down quite well with the inspectors. Did you have a sort of template or anything that you worked from to produce that, or was it your own template? We're just trying to do ours in our area at the moment, and it'd be useful to know one that sort of worked well for the SEF.
So Paul, you might want to say.
So in our region, we have a regional template that's been agreed by the ADCS for our SEF. So I use that. I can send you the template that we use. We do it very much on the basis of a what, so what, now what. So, you know, what do we know? What do we need to do? What's going to make a difference? So I shared that with them. So I'm happy to share our SEF with you, just so you can see the format that the inspectors were happy with, and they drew their Chloes out of that.
Thank you. Yeah, if you were able just to share the template, that would be really helpful. Thank you.
Yeah, if you pop your email in the chat, Camilla, I'll do that.
Any other questions?
Yeah, just before we finish, I'll just share the evaluation form just for everyone, so everyone has the link in the chat.
This will be testing my IT skills now.
So when will the slides be circulated? Is it likely to be in the next couple of days?
Yeah, one of my colleagues will be organising the slides, so that should be sent out soon.
Joe, if I send you the audit template and the SEF template, could you send them out with the slides?
Yeah, that's fine. I'll make sure they get sent out as well. Yeah,
that might be the easiest way to make sure it gets to folk.
Yeah, that's fine. And I put the form in the chat as well, so it'd be really helpful if everyone could share your feedback from the event today.
Well, thank you for the feedback. That's lovely.
I can't see the link in the chat. My chat seems to be on quite a significant delay. Sorry.
That's okay. I'll put it in again now.
We're much more positive about this than we would have been if you'd asked us a week after the inspection.
Especially because 4 of us went down with COVID literally the weekend of week 3, which was kind of further evidence of working closely together, literally.
Yeah.
When we had our last inspection, our inspector came to the meeting, shook hands with everybody, and then told us later on in the day that she'd got COVID.
Oh no!
Oh no! An extra gift from the inspection team. Marvelous.
Yeah, it went down like a lead balloon. It'd be fair to say.
Absolutely.
And our experience of the feedback was exactly the same as yours. They were, you know, all glowing. Then all of a sudden, just went in,
Yes.
you know. But
yeah,
But ours was following a written statement of inspection, so a written statement of action. So obviously we didn't have the full inspection. We missed that just a little bit. But obviously now we're inspecting one next year, the year after, I would have thought. Yeah, but this was really, really helpful. So thank you. I missed the first session, so slotted into this one. So thank you very, very much.
No, you're very welcome. Thank you.
We wish you all the very best with your inspections.
Thank you.
Thank you very much.
Thank you.
Thanks
Thank you
ever
to
so much.
everyone.
Bye.
Thank you.